Good afternoon, everyone. My name is Greg Hampton. I'm the Senior Director of Membership Experience with NVTC. I want to thank everyone for taking time to join us this afternoon. It's my pleasure to introduce Dr. Cheifetz and Dr. Francis from Inova and hear a presentation around vaccine hesitancy. We look forward to an engaging conversation, and we'll have an opportunity for everyone to submit questions once they go through the presentation, and they'll pick up those and tackle them one by one. So with that, I'd like to turn it over to the doctors.
Thanks, Greg. Greatly appreciate it. Appreciate the opportunity to speak with everyone today. We know that vaccine hesitancy, COVID, it's all over the news. It's a conversation no matter where you go. But we feel as a healthcare provider, we have had many questions come to us, and we think that we have put together a talk for you all today that will help answer some of your questions, hopefully not complicate anything, but really address today vaccine hesitancy. And we'll also dig a little deeper into the various populations that you may be addressing, as well as approach to the vaccinated and the unvaccinated. Can we go to the next slide, please? There we go. So just by way of background, and I will not hesitate to say how proud I am of the Inova health system and all of our providers. I've worked for the health system for almost 25 years. Dr. Francis, who I'll introduce in a minute, who's going to join me in this presentation, has been with the health system and in the area even longer. And let's just say the efforts made by Inova, our community, have been incredible. The work, the providers that have gone on since the start of the pandemic are nothing short of heroic. By way of a few numbers, more than 450,000 doses of vaccine have been administered by the Inova health system, and I am sure we will pass 500,000 not too long from now between boosters, as well as with running some 5 to 11 clinics coming up. Inova, by numbers, vaccinated 9% of all of Virginia and more than 25% of Northern Virginia. And we absolutely teamed with the health district to support high priority groups, especially being the key leader in getting our teachers vaccinated. Inova also has treated more than 9,000 patients over the past 19 months. Not the topic of this talk, but if I could share the depth and details of the technical skill and lives saved by Inova and what has been done here compared, unfortunately, to other areas of the country. We're very lucky to live and be recipients of the healthcare of the Inova health system. Despite Delta variant, cases are going down now, and we hope it's due to vaccination. However, we do know even the vaccinated can spread the virus, even though they may be asymptomatic or mildly symptomatic, and clearly the unvaccinated can spread. We will also touch on a little bit today on COVID vaccine boosters that have been rolling out. And then, of course, just in the news, of course, the 5 to 11-year-old clinics, the 5 to 11-year-olds receiving their vaccines very shortly. I'm going to turn it over to Dr. Clieve Francis to take us through some of the next slides. But let me just say that Dr. Clieve Francis is not only an incredible cardiologist, he is a tremendous health advocate. And he has been a major part of our system in helping to communicate the importance of vaccination across all the different cultures and individuals and populations in Northern Virginia, as well as he is also an accomplished musician, and he is not going to be playing for us today, but his YouTube gives an opportunity to share. And let me just say, he's an incredible human being, he's an incredible musician, and he's an incredible health advocate. So, Cleve, thank you, and I'll turn it over to you before I hop back in further along in the presentation.
Thank you very much, Greg. Next slide. Glad to be here. Let's start with this first slide here for me. Vaccine hesitancy. Just how big is this problem? The first two lines in this slide shows that about 66.4% of the U.S. population has gotten at least one dose. Those over 18, which you guys would be interested in terms of the working force, at least 79.5% has gotten one dose. 57.4% of the U.S. population is vaccinated. 69% of those over 18 fully vaxxed. And that leaves about 33.6% unvaccinated, and accounts for about 20.5% of the working force that you guys would be dealing with. As you see, we've done quite well here in the Commonwealth. It leads up to 82.3% of these folks are vaccinated, but still we're hovering around 30.6% that's unvaccinated. Next slide. And good news for employers, as you can see in the red circle, the 18 to 29-year-olds, at least 68% have been fully vaccinated. Between 30 and 49-year-olds, 66%, and from 50 to 64%, 72% has been vaccinated. And of course, those over 65 not taking any chances, and 85% of those folks are vaccinated. Next slide. But the challenge remains. There's still a number of people who basically do not believe in the vaccination and do not believe that it's effective in preventing serious disease. And as you can see, about, again, 30% is in that category who don't believe that there's increased death from not being vaccinated, or if you become seriously ill, you could be hospitalized from the COVID. Again, that same percentage. So we're dealing with basically a hardcore group who have at this point have not been convinced to be vaccinated. Next slide. As far as mandates are concerned, the government requirement for large employers to vaccinate their employees, at least 58% of the public agree with that, and a good 39% do not agree with that. Next slide. And we dug a little deeper. Now, those people who, if they were required to get either the vaccine or get tested weekly, it's up to about 56% would prefer weekly testing. Very interesting. And of people who would lose their jobs rather than get vaccinated, we found that at least 50% of people would be willing to change employers rather than get vaccinated, of that group. Next slide. We divide this hesitancy into two separate groups. One that I coined this term early on called healthy hesitancy. And it's okay to question, and we welcome that. We do some very elaborate testing and surgeries at our hospital, and we want people to question, and we have to explain it. So some cases people are medically contraindicated for getting vaccinated. So that's people with severe allergies. If they have that, that's quite a concern for us and for them too. And some people are just afraid. It was a new vaccine, a newly manufactured vaccine. We took some shortcuts in the public's eye to get this vaccine to market, and there's a lot of fear and uncertainty that we can discuss. People were in the category of let's wait and see what happened to those who took it. So a lot of time has elapsed, and we know a lot about what we didn't know before. And people getting conflicting information from one person saying one thing, another group saying another thing in the public, or rumors as you get on Facebook. And then there were those who were hesitant because of religious reasons. So we've had these we consider to be healthy folks that, there's a discussion, we can talk. Then that's an unhealthy crowd that I feel, those that are steeped in conspiracy theories and, against big pharma, distrust of the government, getting misinformation online, and those who have a dismissive attitude about the pandemic itself, in spite of at least thousands and millions of people dying so far. Next slide. So we know that the vaccines are 86% effective against hospitalization. So if you got COVID, if you've been vaccinated, there's a good chance you're not going to end up in the hospital. You still can get infected. But 92% of the cases in the hospital and 91% of the deaths are among people who are unvaccinated. Significant difference. And we feel that masking and social distancing indoors is still recommended for all, regardless of the vaccine status. And you see a different thing when you go out, but we still feel like those public health measures are significant. COVID-19 vaccinations are authorized. Exemptions is mandatory here at Inova for all medical staff, team members, contractors, and vendors. So we just decided just to get everybody vaccinated. Next slide. So we encourage all employees to get vaccinated. And this is the best approach to limit transmission of this Delta variant and to reduce the chances of new variants developing. And I think in England, there's also a new variant that's developing, and it really has been given this opportunity in people who refuse to get vaccinated thus far. Next slide. Greg, I think.
Already. Yep. Back over to me. So let me just get something out of it. So in terms of questions, we thought it would be advisable for us to kind of share questions that have popped up to us, and you probably have them as well. We do invite you, by the way, if anybody has any questions. I think there's a Q&A feature, and Linda, who is with us, will monitor that. But COVID, just to let everybody know, shooting some of the myths or misconceptions down, COVID-19 vaccines have undergone the most intensive safety monitoring in U.S. history. Yes, they've been more recent, but if you look at the total number of vaccines and the monitoring and the testing that's gone on, it's actually safer than most other vaccines we've had in history. Getting COVID-19, of course, may offer some natural immunity, and current evidence suggests that reinfection with the virus is uncommon in the 90 days after initial infection, although it differs for everybody else how long this lasts. I've had patients say, oh, I had COVID, and I said, how long ago was it? And it was 11 months ago. And I say, honestly, I highly doubt that you are protected from this. Matter of fact, there's recent studies and comments that came out that you are more likely to be protected from the vaccine than somebody who's had COVID and developed antibodies. There's a more consistent response from the COVID vaccine than the infection, which can vary in terms of the amount of antibody that somebody develops. Additionally, pregnant and recently pregnant women are more likely to get severe illness from COVID-19, and the recommendations came out for vaccination in pregnancy, although we always refer a pregnant individual to their physician to discuss if they have any unique aspects when it comes to vaccination. There is currently no evidence that any vaccines, including COVID-19, causes any fertility issues in men or women. I'll also say here, we may say it's in the slides coming up, also that actually, let me just address it here. You can get the COVID vaccine simultaneously with your flu shot. To let you know, there are still pharmacists and physicians who are telling people to wait 2 weeks. It is not the case. unless somebody's known to have allergic reactions to one or the other where we would want to separate them. The COVID vaccine, if you got it previously, and we're not talking about the side effects you get after the COVID vaccine, the achiness, we're talking about true allergic reactions, as well as from the flu vaccine. If those are not the case, which in the far majority of individuals it's not, that co-administration is perfectly fine. And then again, the vaccines for children age 5 and older should be available this week. One thing to share with everybody also, I know that there are even some patients that may get frustrated even with my office or different locations. The pharmacies will receive the vaccine often from the federal government, whereas the doctor's offices and the health systems are working through the state. So you might see a difference in the timing where, a CVS or Rite Aid or Walgreens may see a vaccine ahead of my office, for example. Trust me, every healthcare provider wants to provide vaccinations as soon as they are available. Next slide, please. All right, so we did feel it was important to address the aspects of testing, because some of you may have individuals who do seek religious exemptions or have medical exemptions. We're going to address those in a little bit more detail in a second. But I will tell you that if you impose or allow individuals to have exemptions and choose to elect to have a testing procedure, whether it be once a week or twice a week, a lot of entities will allow a rapid antigen test, which we actually discourage. If you read the information on an antigen test, they are designed, the majority of them, for symptomatic individuals, meaning that asymptomatic individuals or screened individuals have a much, much higher chance of having a false negative. And that if you're going to do testing, weekly testing for those who get exemptions, that PCR is the gold standard. It may take 24 hours to turn around, but if people have a regular cycle of testing, it should work. And right now, PCR turnaround happens to be usually in 24 to 48 hours regarding testing. Again, Cleve, myself, most healthcare providers hope people will seek vaccination, but we do want to mention that. Careful that all tests are not the same, and that you could be, in essence, not getting the information you seek if you allow antigen tests for people who are non-vaxxers as a screening form. It is not advisable. There may be ones that have been developed in companies that may come. If they show the data, that's fine, but I can tell you the data that I've reviewed to date, that antigen testing is, again, used in symptomatic individuals only, and that's not the purpose of what's going on here. In terms of boosters, I think most people watch the news, but Pfizer and Moderna vaccines are recommended for those over 65, age 18 and up, with long-term, if they're in long-term care, if there's underlying conditions, or in high-risk settings. And then some people get some confusion. It's not here on the slide, but there's a difference between the Moderna booster, which is a half dose, and a third dose. A third dose of Moderna is specific for individuals who are immunocompromised, might be under cancer treatment, whereas a booster is virtually everybody else. And then the Johnson & Johnson vaccine was approved, I think, a week or two ago, maybe 3 by now, that anybody who's received over age 18 who got the first J&J vaccine 2 months after their first dose are eligible for a booster. And there's some good data even to show, as you'll see there, the mixing products may be considered for booster dosing. Some reports have come out that both Pfizer and even Moderna more have resulted in exponential increases in antibodies by doing a J&J on the first one and then having your Moderna booster or your Pfizer booster. Next slide, please. All righty. We felt important to comb the literature for you all and try to help you out, because we know that the religious exemption is a sensitive topic. Thanks to Linda, who's done an incredible job in putting this together and finding the research, that Title VII of the Civil Rights Act stipulates, and again, I'm not an attorney. If there's any attorneys out there, that have greater understanding, we yield to them. But what we've learned is that Title VII of the Civil Rights Act stipulates that all U.S. workers are entitled to qualified religious accommodations, but the burden of proof rests with the employee or the worker. Some statements are they must have a firmly held religious belief, that the belief has to actually conflict with the vaccination, that any accommodation or alternate working condition must not cause an undue burden on the employer, and the is there, not the employee, but the employer. Employers are legally allowed to ask the employee to give more information about why their practice, a particular religious beliefs and practice conflict with vaccination, to understand the sincerity of that, the belief or the practice. They may ask employees' vaccination history, even church attendance, other behaviors based on religious beliefs. The comment here about common OTC medications, because many medications in their development use fetal cells, and we will tell you that the vaccines currently are not produced with fetal cells. Early research with some of the vaccine candidates did use fetal cells, but it's not part of the product. And if you look at most major religions, either do not object or they support vaccination, and those religions are listed here along with the couple that do not. And so we know this is sometimes contentious. We do highly recommend you form a process, you form a panel, and you are, of course, consistent in your application of whatever requirements that you stipulate for exemptions. Next slide. Linda, I think you were going to take this. You get the honor of the research, and we found some of these things fascinating. And again, with COVID, we're all just trying to stay ahead. And I think there's been some unique approaches by some companies. So Linda's going to bring us through this slide.
Sure. Thanks, Craig. You know, it was very interesting sort of looking at what other companies are doing. And you can see here, there's an article in the U.S. Naval Institute Press, because I know we have a lot of federal contractors that are part of NVTC. And you can see here, they have taken a very firm approach. And there's a quote in there that said they have not approved a religious waiver for vaccinations in the past 7 years. So they obviously feel like they're on very firm ground. United has granted some exemptions, but those employees have, taken on some pretty steep penalties. GE and Amtrak have gone through and created fairly extensive questionnaires for employees. Several other health systems, we didn't do this, but other health systems have asked for employees to stipulate that they don't take 25 or so of over-the-counter drugs that Craig mentioned. So employers are, in many cases, are taking a pretty hard line on the religious exemptions. And you can see Delta has added a financial penalty. A recent Gartner survey, this is from October, basically said about 1 in 4 companies are or are planning to require vaccinations. So there's a lot of literature out there that you can take a look at as you and your HR departments and your legal counsel pull together your policies around your expectations with respect to vaccine and bringing employees back to the office. A lot of companies, there is too many to list, have, for the most part, said you can't come back to the office unless you're vaccinated. They've taken a little bit softer line on people who continue to work remotely. So that just gives you kind of an overview. The federal government has asked OSHA to issue something called an emergency temporary standard that will mandate vaccines for businesses with over 100 employees. So that's definitely something to keep your eye on. Thanks, Craig. I'll send it back to you. Or Dr. Francis, actually, you're next.
Next slide. Oh, the other thing I was going to add in terms of medical exemptions, we are reviewing all the medical exemptions, and we're not only accepting just a doctor's word that person is medically exempted, but they will have to provide actual evidence of severe allergies, and so that's a change in our policy here too.
And Cleve, to your comment, so people are aware, amongst the exemptions that are medical, allergic reactions to the components, absolutely. And in some cases, there are individuals who need to delay vaccination because, for example, they're on an immunosuppressive medication. But in general, there are very few medical exemptions for this vaccination that according to evidence and recommendations should be approved. And so asking for validation for the medical exemption is between obviously the employee and the company, but we want to point that out. It is really about having an allergic reaction to the components as really the main medical exemption.
We looked at this early on as what we call a hand-to-hand combat with the virus. And according to the Kaiser Family Foundation, 83% consider their physician to be the trusted advisor and giving them advice. And we compared to 70% with the CDC, Dr. Fauci was down to 55%, and the religious leaders were down to 30%. And we at Inova took the approach that we see people on average 4 times a year and spend 15 to 30 minutes with them. It's a lot of gap, a lot of time to pick up bad information. So we got a bunch of physicians together, and we actually went into my field, the music business, and we formed small videos. Next slide. And where these doctors actually recorded using their smartphones a message with all the information about the vaccine, had the pictures on it. And we had this put online so people could access this on their phones, their computers. And also we had a web page at Inova, Inova.org, get the vaccine. So you can see that on the Inova site. So this was quite successful early on in convincing people who were what we call the healthy hesitants. And we're still dealing with that. I said it's less and less because most folks now know about the virus, and we're dealing with basically hardcore people who will not get vaccinated. Next slide. I think, Greg, that's your.
All right, so just some thoughts here for you all, which will be: will you require vaccination as a criteria for returning to in-person work, or honestly for every employee? And some things to be prepared about. Are you prepared to lose employees as a result of requirement? We lost very few employees, but us, like other companies, have done so. And then what are your criteria for exemptions? And as I said, I think Linda did a great job sharing and the presentation and I mentioned earlier in an earlier slide, be consistent and use what's out there to leverage support. This is about, of course, respecting people's rights, but this is a public health emergency, and this is about protecting everybody else in your work community as well. The categories of employees or team members that you're going to be facing are obviously the vaccinated. And as a reminder, and we can't hit this home enough, vaccinated doesn't mean you're not going to necessarily carry COVID and spread it. So there's still the necessity for wearing a mask and distancing and the appropriate things in the office setting. We still mandate mask wearing, whether it's in our clinical spaces or non-clinical spaces. There's also the vaccinated with significant health risks. There are some people that they'll get vaccinated, but still may be immunocompromised and at higher risk. I think we saw that with Colin Powell. So just to be aware that you may have to provide accommodations even for some of your vaccinated individuals because of their underlying health situations. There is the unvaccinated verified medical reason, like the severe allergic reaction. And there's the unvaccinated, still undecided, that why we're doing this talk. This is where we're trying to convince. A big key focus now is also on parents and their kids. You know, the kids are in school now, and yes, they try to wear masks, but there's a lot of spread that can occur there. So the more people we can get vaccinated, the sooner COVID disappears, and the sooner we avoid the risk of variants that could overcome our vaccines and create a resurgence of COVID, as we've seen previously. And then as for the unvaccinated, never intend to get vaccinated. That's where everybody, the companies are encouraged to make some tough decisions, but the right decisions to protect all of your employees. And so, and then how will you handle employee questions? We're always a resource to help you work complex questions or issues that may arise. But really, it's going to come down to your company making some decisions about vaccination and policies. Next slide. So I think we're at the end. Dr. Francis or Linda, was there anything I left out that you'd like to comment on? Otherwise, if there are questions, we can open it up to question.
Yes, if you have a question, please look on your screen and click the Q&A function, and we'll certainly wait a few minutes if you have some questions. We're happy to try to answer them.
While we wait for a question to come in, trust us, we know that emotions run high when it comes to COVID, and the best thing you can do is make sure whatever you do is that your communications are repeated in multiple formats, again, that you're consistent in your application, that it is about the health and safety of individuals. I will share, I think Linda's slide also had noted there that health insurance companies are raising premiums for unvaccinated individuals, and unvaccinated individuals could end up costing companies huge amounts of money, especially if somebody gets COVID and they end up in an ICU and they end up potentially even on ECMO. And so unvaccinated individuals are a health risk to your company potentially, but also could end up being a significant financial issue for everyone.
There was an interesting statistic, Craig, that when Delta made its calculation about charging an additional $200 a month in terms for people on their health plan, that they based that on what they thought the low end estimate was for COVID hospitalization per patient, and that was $50,000 per patient. That would hit their insurance plan. So
that does not surprise me in the least. Yep, absolutely.
Right. So no questions still. So
I think we've answered all the questions. That means we hopefully did an amazing job. But we know that there are going to be questions that arise at some point. Dr. Francis, any closing comments?
No, I think this is a good forum. I think as long as people should ask questions, and because we are dealing with we're in a pandemic. This is a deadly virus to some, and some people can catch it and they'll be okay. But I think there's also a move to be concerned about other members in our community. We'd like for them to live as well. And like what happened with General Powell, I mean, it's unfortunate, but he was a guy that couldn't afford to be around anybody with the COVID. So let's all have a safer place, and we're all on the same team. But I know at Inova, we're in a healthcare facility. Our threshold was pretty high. We would not allow our workers to infect other people and to infect coworkers. We work in a very close environment. So
questions that have come up, by the way, are about the boosters. Again, this is only going to be a hunch, but we are likely going to see, similar to flu, annual COVID boosters. it will probably be geared toward variants. It is a high probability. The other thing important to say today is get your flu shot. Last year we saw hardly any flu because all the kids were home. With the kids in school, we are expecting a surge of flu. And then if there's one, you don't want to get flu and then get COVID, that's for sure. But two, we have to figure out, is it flu or COVID? And if you have a flu vaccine, you're less likely. Now, we don't know what the coverage point is. I'll also point out to everybody that the flu vaccine in an amazing year has about a 60%, 65% coverage. In a not so great year, it can be 25%, although makes the illness mild. There's an expectation of COVID vaccines when they drop below 80% that people start to get concerned. These COVID vaccines are the most effective vaccines that we've seen in history. And so please make sure that whether it's you, your loved ones, whomever, that I would encourage a flu vaccine policy, although that's not the topic of today's talk, as well as COVID vaccination. And is there, I got a red dot, if there's no other, let's see, can Dr. Francis discuss concerns around heart inflammation? You got the myocarditis question, Dr. Francis.
Right. That's a reality. There's a remote chance of myocarditis from the vaccine. It's usually not a fatal or something with long-lasting consequences. The patient will get over that. They have to just rest. But it turns out interesting. If you get COVID, the chances of getting myocarditis is markedly increased as part of the infection. So, the vaccine is much less. If you get COVID, it's more, and usually not a fatal condition. I say, you can never say never, but it's turned out to be a minor thing that's treated with simple rest, and people go on with their lives.
And then there's a
it's
second question
when
there.
you're vaccinating that many people on a long-term basis, you're going to get some, like with the Johnson & Johnson had the blood clot, but that turned out to be a very insignificant number of people compared to the number of vaccinations given. So, it's nothing's without risk at all.
Yeah, the latest statistics are more than 400 million doses have been administered worldwide of this vaccine. So, and Dr. Cheifetz, do you want to take the fertility question?
So I'm not an OBGYN, but I'll take the fertility question based on science. Somebody said you spoke about fertility, but the other concerns we've heard are related to birth defects or medical conditions down the road, which is deemed as untested during a short time frame. It is a short time frame, but what we can say is that if you consult the experts, that it is deemed to be safe. If you look at vaccine history in general, that individuals don't obviously develop birth defects, nor do they have health issues or medical conditions down the road from a vaccine. Correct time will tell, but the risk of long-term, a long hauler syndrome, and the risks, I have patients who have symptoms of COVID who now have chronic arthritic complaints. And so we are seeing far more individuals who have COVID that are have a new medical or multiple medical conditions versus what is being said. And by the way, I'm not saying this to be argumentative with anybody. There is no scientific data to say that's true or not. That's people theorizing. But to the comment and respect of the question, time, we can't advance time. Our best experts, our understanding of the science says that it should not be concerned, but I can't predict the future. I don't know if Dr. Francis wants to add any comment to the fertility.
The thing about with pregnancy and all of the major organizations, medical organization, OBGYN associations and doctors have gotten together, that a woman who is pregnant who gets COVID stands a great chance of having a stillborn. Also has a great chance of dying, either during or after delivery. There was a sad story about a woman in Northern Virginia who, in her 30s, moved down to Florida, got COVID, and she died about 8 hours after delivering her baby, and no other health problems. So I think they've shown that it's safe to breastfeed if you've gotten vaccinated. But I think overall, the recommendation is for people planning on getting pregnant or pregnant to get vaccinated to avoid getting COVID, because it's more dangerous if you get COVID when you're pregnant.
I would also
And by the way, I want to be
suggest
very
that-
respectful. Go ahead, Linda.
Oh, I would just also suggest what Inova did was consult with, I don't know the full name of the professional association for OBGYNs, and there I would encourage you could just Google it. There's a lot of really good research, and there has been some testing done around whether the antibodies pass through and protect the child. But you probably find some good information there on, and at least the most up-to-date science that you could potentially use related to some Q&A related to birth defects or medical conditions down the road. Sorry, go
And I
ahead,
don't want
Dr.
to
Cheifetz.
I don't want to simplify that question. I think it's a very, I want to be very respectful of the question, but I want to broaden that question, or at least that comment, a little bit, in that there have been several very well done studies that have shown that 80 to 90% of determinants of health are based on what individuals do in their life, and not even anything they get from their physician or medical care. And to that point, whether it's eating the wrong things, not exercising, there are so many things that we as humans do with poor health habits that result in hypertension, stroke, coronary disease. Those are so modifiable and so known, versus taking a vaccine that could protect you from long-term symptoms and protect you from dying, versus the potential of what science hasn't proven yet. And everything I just mentioned, science has proven. So I know we're all probably in agreement here. We can't predict the future, but there's nothing telling us to suspect that these vaccines are going to lead to untoward long-term consequences, although we do already have data that the infection itself will, as Dr. Francis has said. All righty.
Okay, any
If
more
there's
questions,
no
anybody?
other,
Okay. Go ahead, Dr.
if there's
Cheifetz.
no other questions, we want to sincerely thank you for your time. We are always here at Inova to be your health experts to the best that knowledge will allow us. The slide that's up there is really focused for you all coming from the corporate sector, in that Inova knows us for our hospitals and our community support. Additionally, all the programs that are listed here are corporate focused and corporate based, whether it's executive health or EAP, our occupational health clinics. A lot of people don't know that we do most of the public safety, police and firefighter exams, and actually our 4 clinics were knee deep in protecting first responders when COVID hit. And so not only were we protecting every member of our community, we were protecting our own healthcare providers. We were out there helping police and fire. And then again, wellness being a priority. And if there's anything that's more important right now than anything else, it's your health, it's your wellness, it's your mental health. And so if there's anything we can do to help support you in any of these endeavors, please let us know. And we all, on behalf of all 3 of us, thank you very much.
And also on behalf of NVTC, to the Inova Health team here, Dr. Cheifetz, Dr. Francis, and Linda, thank you very much. This has been very informative. We appreciate the information that you reviewed and presented today. Also would like to thank everyone who joined us, and let you know that we will be posting this from our website as well as from YouTube that you'll be able to use as a resource and come back, and as well let us know if you have any additional questions. So thank you very much, everyone, and have a great afternoon.